Hello, I'd like to share some information with you today in regards to anxiety attacks versus panic attacks. This information is coming from verywellmind.com and it's written by Cheryl Agram and medically reviewed by Stephen Gaines. So you may hear the terms anxiety attack, panic attacks used interchangeably as if they mean the same thing. It's understandable given some of the symptoms of panic and anxiety attacks can be similar. They are similar, including rapid heartbeat, dizziness, shortness of breath. In practice, however, panic and anxiety have different features and behaviors that are exhibited through these two different entities. So behavioral health professionals use the terms for specific symptoms and disorders. So panic attacks are an abrupt surge of intense fear or discomfort accompanied by other physical and mental symptoms. Anxiety, on the other hand, is part of the emotional and protective responses hardwired into the human body. It is when anxiety is excessive or gets in the way of a person's life that there are causes for concern. If you're experiencing significant anxiety or panic, it is important to understand their definitions, the symptoms, and possible treatments. So the clinical differences. So professionals who treat mental health conditions, like myself, based on a diagnosis, a definition is found in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, 5th edition. Anxiety and panic attacks may feel the same at times. The differences are outlined in the DSM, assist in identifying and distinguishing between the both of them. So in the DSM-5, the term panic attack is used to describe the hallmark features, if you will, associated with a panic disorder. However, though, panic attacks may occur with other psychiatric disorders. The term anxiety attack, on the other hand, is not defined in the DSM-5. Rather, anxiety itself is used to describe a core feature of several disorders, illnesses identified under the headings of anxiety disorders. So some of the most common mental health diagnoses under the headings may include agoraphobia, obsessive compulsive disorder, social anxiety disorder, separation anxiety disorder, panic attacks, generalized anxiety disorder, post-traumatic stress disorder, to name a few. The difference between panic and anxiety are best described in terms of intensity of symptoms and the length of time of the main symptom occurring. So panic attacks. Panic attacks are an intense and sudden feeling of fear, terror, and or discomfort accompanied by several other mental and or physical symptoms. According to the DSM-5, panic attacks are characterized by 4 or more of the following symptoms, whether that is mental feelings of unreality, fear of dying, fear of losing control, feeling detached from oneself. The physical can be trembling, shaking, feeling of choking up, chest pain, heart palpitations, pounding hearts, excessive sweating, nausea, feeling dizzy, numbness or tingling sensations, chest pains. They can also be hot flashes, chills. Panic attacks usually occur kind of without warning and are obvious, immediate, or without or with immediate trigger. So in some cases, there are expected because the fear is caused by a known stressor, such as a phobia, and other times they are not. So panic attack symptoms can peak within 10 minutes and then they typically subside. However, some attacks may last longer or may occur in successions, making it kind of difficult to determine when one attack kind of ended and another one kind of began. So, following an attack, it is not usually uh, unusual to feel stressed, out of sorts, worried, or on edge for the remainder of the day. Anxiety, though, generally intensifies over a period of time and it can be highly correlated to excessive worry about a potential danger, whether that danger is reality based or perception. If an anticipation of something builds up and there's a high amount of stress that reaches a level where it becomes overwhelming, it may feel like an attack. The symptoms of anxiety are, though, for the mental, difficulty concentrating, restfulness, irritability, the physical. There may be some disturbed sleeping, some fatigue, dizziness, increased startle response, increased heart rate, muscle tension. And while for some the attacks of anxiety are similar to those associated with panic attacks, they are generally less intense. Um, Unlike panic attacks, the symptoms of anxiety may be persistent and long lasting, whether those are days, weeks, or even months. So, diagnosis. Effective treatments are available that can improve outcomes and well-beings. It is important to talk to your doctor and having the symptoms of anxiety or panic attacks. Um, a doctor or a mental health professional can also ask questions about symptoms, including intensity, durations, and the impact on your normal functioning throughout the day. So, based on the evaluation, the assessment, or speaking with the mental health provider, the doctor or the mental health provider may make a diagnosis based on the criteria found in the DSM-5. So, treatment for panic and anxiety. Whether you're dealing with panic, persistent anxiety, and or both, effective treatment is available. You may decide to try one or a combination of these methods, whether it's medication, self-help techniques like breathing exercises that will kind of promote a relaxation and can benefit in allowing you to work through the symptom, as well as psychotherapy. Psychotherapy can help better assist you, support you with understanding your symptoms, developing ways to manage them, determining your path for the future, working through those on discomforting moments, and gaining clearer perspective that will allow you for a more hopeful outlook. So, anxiety and panic can potentially disrupt your everyday life. Whether you yourself, a friend, or a loved one is experiencing these symptoms, um, knowing what can be of assistance is valuable. So, taking time to speak with your doctor, your nurse practitioner, mental health provider, therapist, your counselor, those are the first steps in assisting with lessening those symptoms. If I hope this information was of assistance for you today, and I hope that you enjoy the remainder of your day.